injectable solutions. Okay, injectable solutions are best stored in always glass ampoules. Okay, you can refrigerate at 4 degrees or you can store at ambient temperature, okay, 15 to 30 degrees, or you can oven temperature 37 degrees. Okay, so the best suitable container is glass ampoules. Option is B. Next question. Latin term statim. Okay, statim on prescription you can remember like this. IM, it is immediately. Statim is immediately in Latin terms. Okay. Before meals means antisebum. Okay, antisebum. Once daily means QD. Quack die. Okay, quack die. Quack die. Antisebum. Okay, at bedtime means hora somni. Quack, hora somni, simply HS. That is at bedtime. So, answer is C. Next, what is the term for the separation of particle by size? So, particle by size, sedimentation, sieving, cyclone separation, all these are used for the separation of particles. This is sieving. So, answer is D, all the above. Next question, which of the following is an advantage of using plastic containers over glass containers for pharmaceutical packaging? So, why we use these plastic containers? Let us see the options. Plastic containers are impermeable to gases. Advantage, no. Plastic containers are more resistant to chemical interaction. Plastic containers are less likely to break and cheaper to manufacture than glass. Here answer is C. Plastic containers are less likely to break. What is the primary role of antioxidants in parenteral preparations? What is antioxidant agent which prevents the oxidation? So, the main aim is to prevent oxidation, to prevent microbial contamination, prevent oxidation, maintain isotonicity, enhance solubility. Option is B here. Fifth question answer is B. In metrology, what is the method used to calculate the dose of a children drug based on body surface area? So, BSA method. This is body surface area, BSA method. Young's rule is age by in years by age plus 12 into adult dose. Clark's rule is to weight of the, okay, weight in pounds by 150 into adult dose. Freud's is age in months. Age in months by 150 into adult dose. So, here correct option is body surface area D. So, Young's is age in years, Clark's is based on weight, Freud's is based on months, age based on months. Government of India, Ministry of Health and Family Welfare publishes Indian Pharmacopoeia is based on Drugs and Cosmetics Act 1940. Answer is A here. Next question. The actual process of publishing the first Indian Pharmacopoeia started under the chairmanship of, see here, actual process started in 1944 under the chairmanship of Chopra. First edition 1955 under B.N. Ghosh. This is first edition. Second edition 1966 under Mukherjee. This is second edition. Third edition under Nityanand. Third, fourth also under Dr. Nityanand. So, here correct answer is Chopra. Okay. The first edition of Indian Pharmacopoeia, just now I said, was published in the year under the chairmanship of 1955 B.N. Ghosh. If a person is infected with deadly pathogen or toxin against which quick immune response is required, ready-made antibodies are directly given to protect that person based on the principle of passive immunity. Passive immunity is what direct antibodies, giving direct antibodies to the person rather than making the person to prepare the antibodies within the person itself. Okay, that means rather than generating the antibodies in the person, if we are directly giving the antibodies to that person, then it is passive immunity, which lasts for some few weeks to few months only. It is not permanent. Okay, it is again this passive immunity, two types: natural passive immunity and artificial passive immunity. Artificial and natural means what? Transfer of antibodies from mother to fetus is an example for natural passive immunity. Here what is the given? Select the option that does not represent a case of passive immunity. Which is not a passive immunity? See, giving antivenom, which is consisting of antibodies against a snake bite, it is a passive immunity. Okay, this is an example for passive immunity. Here we are giving antibodies directly. Administration of anti-tetanus serum, this is also an example for passive immunity. Administration of tetanus toxoid to the newly born, here we are giving this toxin. Okay, toxins we are giving and making the person accumulated to that antigen, so that person will generate their own antibodies. So, this is an example for active immunity. Okay. So, here option is C. Next question. Immunization provided against the tetanus is a passive immunity, passive immunization. Yes. Injections provided against the tetanus contain performed antibodies. So, this injection is containing antibodies which are given directly. That is why this is a correct, A is correct and R is a correct explanation for A. First option is 11th option, answer is A. Read the statement 1 to 4. How many statements are true for passive immunity? Same. Anti-tetanus serum administration after an injury. Yes, it is example for passive immunity. An injection of antivenom after snake. This is also antibody containing direct injection. That's why this is also an example for this passive immunity. Newborn vaccinated against hepatitis. This is an example for active immunity. So, no. Lifetime immunity attained by suffering from chickenpox. This is also when you give antigens, the person will attain lifetime immunity by generating their own antibodies. That's why this is also wrong. This is also active immunity example. So, options are 1 and 2. So, how many, read the statements, how many are true for passive immunity? 2 statements are true for passive immunity. Option is D. Next, main difference between the blood plasma and serum is, plasma and serum are involved in blood clotting. Serum is the liquid that remains after blood has clotted. Plasma is the liquid that remains when clotting is prevented with the addition of an anticoagulant. Plasma has proteins involved in blood clotting, and serum does not contain. No, does not contain, it also contains. Plasma and serum contain cells and proteins. The main difference between the blood plasma and serum is, plasma and serum involved in blood clotting. Next, serum is a liquid that remains after blood has clotted, and plasma is the liquid that remains when clotting is prevented with the addition of an anticoagulant. That is the main difference. Serum is the liquid that remains after blood has clotted, and plasma is the liquid that remains when clotting is prevented with the addition of an anticoagulant. So, this is the answer. B is the correct option. Next, what is the main function of buffer system in the blood? Blood buffer is curiosity of biophysical chemistry. They are involved in regulation of pH on value related to the actual need of the organism. They are involved in the regulation on strict value. No, it is nothing like buffers. No, answer is B. They are involved in the regulation of pH. Okay. Which hormone or cytokine stimulates formation of red blood cells? Erythropoietin. Erythropoietin is involved in the formation of red blood cells. Interleukin 1 is involved in the immunity. Okay. Interleukins are related to fever, immunity related issues. Vasopressin is maintenance of sodium levels, water levels. Okay. So, here erythropoietin is the one which is responsible for the formation of red blood cells. So, answer is A. Next question. Narcolepsy is a disease related to sleep disorder. Okay, here compulsive stealing habits, no, forgetting disorder, attacks of epilepsy, no, excessive sleeping disorder. Narcolepsy is a sleeping disorder. Answer is D. Name the bacteria that causes dysentery. Shigella dysentery. Okay. Here, Shigella dysentery. Vibrio cholera is responsible for cholera. Streptococcus is responsible for various species are there, bacterial infections, gram-positive. This is for TB, Mycobacterium tuberculosis. So, Shigella is the responsible bacteria that is causing dysentery. Answer is A. The deficiency of vitamin E leads to bleeding gums, is soft bones, is weakness in muscles. This is for D. And neurological disorders, B. So, here weakness of vitamin E leads to weakness in muscles. C. Radioactive iodine 125. This is a radioactive pharmaceutical. Okay, radiopharmaceutical. It is helpful in thyroid functioning to detect and estimate drugs, hormones in the body fluid. Both A and B are correct. Option is here C. Next, the effect of radioactive particles passing through biological tissue depends on the ability of the radiation to penetrate the tissue. Okay, depending upon that, the radioactive particles passing through the biological tissue. Next, the energy. So, ability and the energy and the rate. All are important factors for passing through the biological tissue. Okay, so answer is D. All of the above. Next, which of the following containers is most suitable for storing light sensitive pharmaceuticals? No transparent, light sensitive, that is why, that means what, when light is passed into that pharmaceutical, it gets spoiled. So, amber colored glass ampoules, okay, amber colored glass containers are one which prevents the passage of light. And for light sensitive pharmaceuticals, always you have to store them in amber colored glass. Which drying method is most suitable for heat sensitive pharmaceutical products? So, tray drying, fluid bed drying, rotary drying. All these three options involves heat. So, freeze drying or lyophilization is the technique where you can dry by using this for this heat sensitive pharmaceutical products. So, lyophilization or freeze drying is the option B is the correct one. Next, which unit operation is employed to remove moisture from the pharmaceuticals? Filtration, no, this is all you know. Distillation is the separation of the mixture. Filtration is solid and liquid filtration. Drying is what, where you separate moisture from the product. So, to remove moisture, drying is used. See, answer is C here in 23. Next question. Which dosage form is designed to release the active drug slowly over an extended period of time? So, slowly the drug will be released in immediate release tablets? No. Sustained release? Yes, slowly. Effervescent? No. Chewable tablets? No. Sustained release tablets means what? Slowly the drug is released over a period of time. So, here answer is B. Next question. What is the key role of the binder of the tablet formulation? To aid in tablet disintegration, we will use disintegrants. For this process, disintegrants are used. So, this is not option. Facilitate the compression process? Yes, in one way. Mask the bitter taste? No. Protect the tablet from moisture? No. For this purpose, we will use certain coaters. So, here binders are used for making volume and also compression to make it into a perfect composition. Okay, so here microcrystalline cellulose, okay, some pegs, these are binders we will use for the tablet formulation. So, option here is B. Which type of distillation is used to separate a mixture of two or more components with close boiling points? When, see, distillation is a process of separation of the mixture of liquids. Okay, simple distillation, steam distillation, vacuum distillation, where you apply vacuum here. Steam distillation means where steam is passed into the mixture of the sample. Okay, steam is passed and with that steam it gets boiled and gets separated. Fractional distillation for refineries, petroleum refineries, we will use fractional distillation where the boiling points, according to the closest boiling points, they will get separated in the different fractions. So, it is answer is fractional distillation B. What would happen if skip this one? Side effects of sulfonamide drugs. Sulfonamide drugs side effects are very, very important. First one is Stevens-Johnson syndrome. Okay. Next is hypersensitive reactions. Hypersensitive reactions. Next is crystalluria. So, if you see whether we all this have this or not. Crystalluria, yes. Photosensitivity or hypersensitive phototoxic reactions, kernicterus, yes. All of the above. Answer is D, all of the above. Side effects of sulfonamides. Next, structurally, how would you define the following structure? See here, this is nitrogen which is attached to 3 other components. So, it is tertiary nitrogen. Answer is here C. Sulfonamides can be classified as bacteriostatic. Which of the following is the best description of bacteriostatic medication? Bacteriostatic medications kill existing bacteria. No, static means stopping. Cidal means killing. So, here cidal is killing, so it is not. Bacteriostatic medications stop. Yes, stop bacteria from reproducing. Medication freeze bacteria. No. Multiply bacteria. No. Answer is here B. Bactericidal means killing, static means stopping bacteria. So, answer is here B. Next, which of the following is not an external route of administration? External route, rectal is external, sublingual is external, intranasal is external, intraarterial. Here this is not an external way of route of administration. So, option is here D, 31. Next, which of the following statement is true for oral route of administration? Unpalatable drugs, that means these are difficult to take, are difficult to administer, yes. May cause emetic action, yes. No, both A and B is correct. It cannot be used in emergencies. So, oral drugs are unpalatable and causes emetic action. Answer is D. Calcitonin is given via intravenous, intramuscular, both. Okay. Full form of POISE. POISE is used in healthcare systems which provides information, okay, and guidance. Okay, it provides information and guidance. So, full form of this POISE is procurement is correct, not preparation. Procurement of information systems effectively. Procurement of information system effectively is POISE, which is used mostly in healthcare system. Next, formularies, pharmacopoeias and textbooks falls into the category of. So, for primary sources, secondary sources. Primary sources are the data, biological data you will get from the or results. Okay, all these published, unpublished articles. Okay, these are all the sources of primary information in pharmacy. Secondary information means what? Any documents or texts, okay, or any papers that are written based on taking these as reference. So, here formularies, pharmacopoeias and textbooks, all these are taken from the primary source as reference. So, these are coming under secondary source. Okay, 35 option is B. Advantages of secondary sources are to provide quick access to primary source, yes. To provide concise and current information on specific topic, yes. Research report leads to inaccurate conclusions, no. Journal sources of high standard and peer reviews, yes. Here advantages, all these are advantages. So, you just can get the review of the primary sources. So, this is inaccurate conclusions is wrong. So, answer is here C. A 75-year-old man had been receiving gentamicin to treat an urinary tract infection. This is aminoglycoside antibiotic. After 3 months of the therapy, patient's serum creatinine levels were 10 mg per dl and serum gentamicin concentrations obtained just before the last dose were 9 mg per dl, which is normal is less than 2, but the concentration is very, very high here in this case. That is due to which of the following is most likely adverse drug reaction in the patient suffering from? It is due to type 2 allergic reaction? No. Type 3? No. Pseudo-allergic? No. Overdose toxicity. That's why the concentration is more than, it's almost 9 mg per deciliter, which is very much more than this normal levels. That is why this is due to overdose toxicity. So, here option is D. Idiosyncrasy. What is idiosyncrasy? Which is unpredictable, which cannot be predicted. Unpredictable reaction to a drug. Predictable? No, not at all predictable. So, it is here unpredictable reaction of a drug is called idiosyncrasy. So, here option is A. Next, which of the following is wrong match? Zidovudine skull defects, thalidomide limb defects, yes. Phenytoin facial defects, tetracycline teeth abnormalities is yes. Zidovudine will be having will not have this skull defects. Facial defects is okay. Zidovudine is not having any teratogenic effects. Thalidomide, because of this limb defects only, racemic mixture is stopped giving as a thing. Okay, and so here answer is will be this zidovudine skull defects is the wrong match. Which of the following chemical constituents? So, aloe consists of barbaloins, ginger, it is alin, lemon peel, hesperidin, olive oil, palmitin. P is 3. P is 3 everywhere. Ginger, Q is 4. Q is 4. Q is 4. Lemon peel is hesperidin. R is 1. This is the option. C is the option 40. Next, which of the following glycoside is used in the treatment of rheumatoid arthritis? Rheumatoid arthritis, Dioscorea, aloe, visnaga and seneca. Not visnaga and seneca. Aloe is also no. Dioscorea consists of saponin glycosides. Okay, saponin, diosgenin, which is useful for as anti-inflammatory and treatment of certain arthritis. Normally, it is rheumatoid arthritis. So, Dioscorea is the answer, which consists of saponins. Next, again, types of glycosides and examples, very important. You have to practice also. Anthracene glycosides are seen in senna leaf. Cardiac glycosides example is digitalis. Saponin glycosides, just now I said it is Dioscorea. Cyanogenetic glycosides are seen in bitter almond. So, here A is 4. A is 4, these two are wrong. B, cardiac glycosides are seen in digitalis, not in bitter almond. So, this is the option. C is 3, Dioscorea, and cyanogenetic glycosides are seen in bitter almond. Option is A. Next question. As per the final report of the highly peered committee on disaster management, which of the following are categorized under water and climate related hazards? Landslides and mud flows, heat waves and cold waves. Heat waves and cold waves are due to this climate related hazards, and landslides and mud flows are water related hazards. So, here the question is under water and climate related hazards. So, it is both A and B. Answer is C. 44th, which unit operation is commonly used to increase the surface area of a solid? That means distillation, filtration, no, not at all. Evaporation, no. Size reduction is what? When you reduce its size, its surface area increases. Okay, so here surface area of a solid is increased by size reduction. 44 option is A. Next, which nuclear accident in Ukraine released radioactive fumes on April 26, 1986? It is Chernobyl nuclear power plant. In 1986, a highly radioactive accident has been occurred, which has taken so many of lives. Okay, it is Chernobyl nuclear power plant disaster. 45 is A. 46, which Latin term indicates that a medication should be taken before meals? This already we discussed. It is antisebum. Before meals means antisebum. Before meals, antisebum. Just going before bed, before going to bed, hora somni, quack hora somni, before bed daily. Quack day means daily you have to take, daily once, twice in a day, 2 times in a day is bit. Okay, so answer here is C. Which of the following is not a unit operation in pharmaceutical manufacturing? Which is manufacturing process, whatever the manufacturing process we will do. Granulation is done, extraction is done, size reduction is done, melting is not a unit manufacturing unit operation. So, it is melting. So, 47 option is C. Rest of all are unit operations. Hydrophonium test is done to diagnose. Hydrophonium test, hydrophonium is given. Okay, this is an anti-cholinesterase which increases acetylcholine at neuromuscular junctions. Okay, and this is used to test the muscle strength, weakness or muscle weakness. So, here myasthenia gravis, it is not COPD, asthma, both are related, glaucoma, myasthenia gravis where you test the muscle strength by giving this hydrophonium drug, okay, which increases the acetyl. So, here in this test, muscle strength is before giving hydrophonium, after giving hydrophonium is tested. So, it is used in case of myasthenia gravis. 48 option is B. What are the main chemical constants of picoryza? Picoryza is consisting of Kutki chemical constants. So, Kutkin 1 and 2, Kutkoside, Picroside 1 and 3, all of the above is the answer. It is having various applications like anti-ulcer, anti-asthmatic, anti-diabetic, antioxidant, anti-cancer. All these are the applications for picoryza, which is consisting of chemical constants Kutki. What are the uses of picoryza? Skip this one. Next question, synonym of Shankapushpi. Shankapushpi in synonyms, it is having different types of names. Shankwel in Marathi, it is called Marathi, it is language, it is Shankwel. Shatamuli, Shankafuli, answer is A and C, D option. Next question, McArdle's disease involves a deficiency of which enzyme? McArdle's disease means it is a genetical disease, okay. So, this is due to the lack of muscle phosphorylase enzyme, okay. It is a genetical disease which is due to the lack of this muscle phosphorylase enzyme. Option is D. Transketolase activity is affected in transketolase is an enzyme which converts this pentophosphate pathway to glycolysis. Okay, it involves in this conversion, and glycolysis is useful for energy production, and from this it is useful for the synthesis of ribose that is used in the nucleic acid synthesis. So, this happens. Okay, transketolase enzyme is responsible for the glycolysis conversion from PPP, and this leads to the energy production and production of ribose that is useful for the synthesis of nucleic acids. When there is a is affected in thymine, see when there is a B1 deficiency, okay, that means thiamine deficiency, vitamin B1 deficiency, the activity is affected because of the transketolase activity affected. So, here the option here is D. Which of the following enzyme is not involved in carbohydrate metabolism? So, cortisol, ACTH, adrenocorticotropic hormones, glucagon, cortisol, all these hormones are useful, okay, useful in the carbohydrate metabolism except this vasopressin. So, option here is D. Statement 1, platelets are involved in the process of blood clotting. Yes. Low platelet count will result in no blood clotting. Yes. Both statements are correct. 55 option A. Match the following blood components. RBC is first WBC we will see transport of energy electrolytes, immunity defense. WBC is for this immunity and defense. Platelets is for blood clotting. RBC is for transport of gases. Plasma is for transport of energy and electrolytes. So, RBC option here, RBC is for transport of gases. One is D. One is D, this one. 2 is C, yes, immunity and defense. Platelets is for blood clotting, 3B, and 4 is A. Option is A, 56. Blood component and its that is present in the aerosol bottle, which will give the actual accurate dose delivery. Okay, metered valves are used for accurate dose delivery for one action. Okay, for one action. So, it is metered valves that are efficiently deliver the drug in the aerosols. The equipment for the aerosols. Particle size determination. Particle size determination is through cascade impactor. Cascade impactor is one which is used for the determination of particle size. Next, identification of propellants. Propellants can be identified by GC, GC-TCD, thermal conductivity detector, and also some spectroscopic techniques. So, it is S. Foam stability can be tested by using this rotational viscometer. Flashpoint is Stagg open cup apparatus. Okay. So, option 1 is T. 1T, 2S, 3Q, 4R. So, just remember this, which instrument is used for which thing. The identification of the propellants in pharmaceutical aerosols, just now I said, pycnometer is no, gas chromatography, there is IR spectroscopy. Option is P and S. So, answer is B, 63 answer is B. Next, which container is commonly used for storing medications that are sensitive to atmospheric oxygen? Amber colored is light, it is for light sensitive. Plastic vials, no. Airtight aluminum containers, rubber closures. So, answer here is C. Okay. For atmospheric oxygen sensitive compounds, we will use C. Aluminum containers. Airtight. What is the term used for solution that has the same osmotic pressure as blood? So, isotonic solutions means both are having the solute concentration and water osmotic pressure, both are same here. There is no net movement, whereas here hypotonic solutions, the cell will swell